and I have a practice in Vancouver, BC called AcuBalance Wellness Center. And today we're doing something kind of special. So got to give you a little bit of background. We're going to have a lecture by Leah Hechtman, and Leah Hechtman has two lectures on the Integrated Fertility Symposium. So we are currently at this time running the IFS 2021. Registration has closed. And Leah Hechtman is a naturopathic physician from Australia, and I'll give her a proper introduction in a moment, but she has two lectures and as part of the IFS, and we're going to be doing this lecture live with you guys, with Leah here to do a Q&A, and it's called Is There Time Up? Understanding the Oocyte and Factors That Mediate Reproductive Competence in Premature Ovarian Insufficiency, so failure, and infertility. Now, what makes this special is this is an IFS lecture. So those that have access to this means they've registered for the IFS. And I got a chance to watch this lecture, and it is brilliant. And it's the end of the month of May, and we had a webinar happening the other day, and we just had a vote who wants us to put another one of these up, because we've been doing these live events and make it available to everybody. So this is what we've done. We put it on our community live webinar section. So this is unique. It's not the typical what we normally do. So here's what we're doing. For those that are part of the IFS, you're here live, you get two CEUs for this, you have the handouts in your IFS account, and you have the recordings available to you if you register for IFS 2021 until June 30th to watch this as much as you want. For those that aren't registered with the IFS, you can watch this free with us now. So if you're watching this on social media, get into the Zoom room and watch this now. We're not providing you handouts. We're not providing you CEUs. We're not providing the recording. You just get to watch this kind of a fly on the wall with us as a gift. Just come and watch this. It's a really good lecture. But you have to be here live. It's not going into the community library. It will go into the Healthy Seminars area where you can register for this like any Healthy Seminars on-demand course. But for today, if you're not part of the IFS, you can enjoy the live replay, the lecture, and you can partake still in the Q&A with us. So what's the community lectures? Under Healthy Seminars, if you go to the resources, we list our community lectures. And if I go to May, we put this one up for May. So this is where it is, under resources. So if you're watching this on social media and it's happening live right now, you can go to the resources, and you can go here and get the Zoom link to join us for the full 2 hours that we're going to be together today. It's not going to go into our community library that's available for subscription, because this is part of the IFS. But again, we just wanted to make this available to you. A few things I want to let you know about, just part of Healthy Seminars. First of all, if you go to the resource section, you will see that we have our regular scheduled programming happening in June. And this is available to all of you guys. These are free lectures. So we have on June 2nd, the microbiome's control of the immune function. So this is an excellent lecture by Tom Bain. We have a lecture by Dr. Mark Ratner on CoQ10 and female fertility. Another brilliant lecture, having the chance to look at the handouts and watch this lecture in the past, where he talks about how the egg needs this energy to do its division, and then to not have errors when the chromosomes from the man and the woman come together, and then how to have the division in the tubes or in the lab, and energy for implantation. He really simplifies to show what happens and why coenzyme Q10 can be beneficial. And he talks about the different ubiquinol versus ubiquinone and dosaging, et cetera, et cetera. It's a fantastic lecture. That's on Thursday. And then you can see we have a live webinar with Yvonne Farrell for CEUs on the Sunday of June 6th. And it continues. So we're going to keep adding to June. So just check out June. We got another lecture on herbs and fertility. We have one on facial aging through the eyes of the patient. We have a cosmetic CEU lecture with Shelley Goldstein on the 13th. And it continues. We got a laser, a cortisol talk with Carrie Jones, and a laser fertility with Anne-Marie Jensen. So usually Monday to Friday are free things for you guys. And then usually the weekends we save for CEU proof courses. This being the exception that we're having you guys who aren't part of the IFS join us. So I just want to let you know that's under the resources. If you're looking for other upcoming live CEU courses, go to the link on healthyseminars.com, and that takes you there. Now, if you're part of the IFS and you can't remember how to get there, just click on the healthyseminars.com website, click on IFS 2021. It'll take you to the IFS website. You can see I'm here, I'm logged in. And then when you go to your dashboard on IFS, it lists all the courses that are CEU approved. Now, we have so much more content than just the CEU approved courses. So if you look here on the dashboard on the left, my courses, these are the CEU approved. If you're part of the IFS, hey, make sure you complete these. Look where I'm at. I got 14 out of the 16 completed. So these are the courses that I've gone through over the first month of May. As you can see, I got one more here on PCOS, and I got an endometriosis course by Leah Hechtman as well that I need to complete, right? And so under here, we got pop-up lectures. So again, if you're part of the IFS, all these pop-up lectures and Q&As that we've been doing throughout May are here, so you can watch those. We got lots of sponsored lectures. I'll touch back on that in a minute. And then again, if you're part of the IFS, remember, we have been putting up public educational videos in the public educational video section on your dashboard. And these are short videos made by experts for the public. So the idea is to educate the public, and they become inspired, and then they want to seek you out for their integrative fertility care. And so you get to share these videos on your website and on social media. And so there are tons here. Integrative approach to PCOS. This is Rebecca Genius, who is a medical doctor. We got Mike Armour talking about research that he just published on acupuncture for endometriosis and herbs for endometriosis. We got Dr. Fiona McCulloch, a 30-minute lecture on egg quality and PCOS, what you can do with diet and nutraceuticals. Ruth Ealing is a MD and trained in acupuncture and an IVF specialist, OBGYN, and she talks about integration. Mark Perlow, an MD, talk about integration, and the list goes on and on and on. We have about 13 of these. We haven't put them all up yet, but they keep coming. So go, if you're part of the IFS, check that out. These are these educational videos that we created for you with our experts. So they have the credibility factor because the majority of them are both, they're either MDs or MDs and TCM trained, majority of them. So there's a credibility factor. And again, they're short videos to educate the public on how they can benefit through the integrative care that you offer. So when you share it, let them know you practice this way and they can seek you guys out. And then I want to mention our sponsors on the IFS website. Anybody can go to this. So if you go to the IFS website, all the sponsors have offered special deals and they have lectures on their pages. So a big shout out to Jane being our platinum sponsor. And if you click on the link, every one of the sponsors has videos, educational videos, because that was part of the deal to be part of the IFS. We asked our sponsors to create content, educational content. Now, again, anybody can go to the sponsor pages. You don't have to be part of the IFS. But in the forums, you have to be part of the IFS. And we have lots of discussions happening in the case study. So remember to check that out. Also to let you know, that's where go to the coupon special offer section. This is where you'll find the deals that all the exhibitors are offering you. So this is where you can go and find that out. So please check that out. And lastly, we have our chat function so we can stay connected. You can see there's 43 users on the IFS website. For those that are part of the IFS, please go in and update your name and your picture by going up here. And then people can see who you are if you're on the site, and we can connect with each other. It's just nice to come to well, I'm about to watch a course and I see somebody I know on here, like I can see Hans is on here. I can send him a little message, hi, and may ask him about a course. Or if I see Misha Cohn on here, who I know is an expert with endometriosis, I may want to talk to her a little bit about the endometriosis. And again, use the lectures and case studies for the discussions. This is really where we want you to do that on where you can have continued discussion. So that's the IFS website. Now, to find your lectures for those that are part of the IFS, remember the dashboard lists the courses there. You can also get it from the lecture section. So if you click the lecture link up here, this link takes you to just the CEU approved lectures. If you just want to work on PCOS, you can click the category and find all lectures about PCOS. You can also find them by speakers. So let's do that now because we're going to introduce our speaker today. So here's Leah Hechtman. Now, a little bit about Leah. She is a naturopathic physician, over 20 years of practice. She has other courses on Healthy Seminars. If I bring you to the Healthy Seminars website, she has an excellent course on the microbiome for 4 CUs. She has a course on endometriosis as well, and other material from IFS that we've put up from her on Healthy Seminars that's available for CU. Excellent courses. Back to going to Leah. She has published, I got to use all my muscles. This is her textbook. This is Leah's textbook. Look how thick this thing is. Look at this book. Oh my God. Our naturopathic physicians, and I love this book. Clinical Naturopathic Medicine, the 2nd edition. Now, I'm telling you, there's a digital version as well, but this book, like, you will be blown away when you go in there and read about PCOS, ovarian reserve. Like, it is one of the most comprehensive textbooks I've seen from a functional medicine perspective, a naturopathic medicine perspective on fertility. It has everything here, not just fertility, like everything, but the fertility section is huge because that's her specialty. So one more time, Clinical Naturopathic Medicine. We were supposed to have Leah Hechtman teach at the IFS 2020 Vancouver. COVID got it canceled. I'm so excited that we were able to organize and have her present this online because her content is A+. Everything I've read that she's done and the courses that she's done, I'm blown away. They are dense. Trust me, you cannot just watch her course once. There is too much information. You're going to be glad that you have the recording if you're part of the IFS. Now, I want to remind you guys of our disclaimer. This is for educational purposes only. This is not meant to be medical advice. If you have a healthcare condition, please seek out a healthcare provider. Again, this is for educational purposes only. This is not intended for medical advice. Please post your questions in the chat room for Leah, and we'll moderate those. And at the end of this lecture, Mia will stick around with us for 20 minutes to do a Q&A. And anything's up for game, not just her lecture. So if you've done her endometriosis talk already, you can ask questions about that as well, because you're going to have her here live. So let's bring up this video. Welcome everybody, those that are part of the IFS. And for those that are just part of the Healthy Seminars community that you're here, we're glad you're here. And again, if you're part of the IFS, the handouts are in your account. After this lecture, go do your assessment tools and your course evaluation if you're part of IFS to get your CUs. If you're not registered for IFS 2021, please enjoy this lecture. And if you really want the handouts, you want the CUs, then you can go to Healthy Seminars and register for the course to get those CUs and handouts. Without any further ado, let's get this lecture started.
Hi, everybody. It's great to be here, and I'm really looking forward to getting stuck into this topic. So I promise I won't run off on too many tangents. Obviously, a lot of this topic is part of my PhD, so I've been very heavily involved in all the research around it. But I wanted to provide you with a talk that really was looking today at the oocyte itself and factors that mediate reproductive competence, specifically when we're looking at the premature ovarian insufficiency cohort of women and women that experience infertility. And we know that as clinicians, a woman that presents and her ovarian reserve is declining or her ovarian function is poorer, we know that it's quite difficult as clinicians to be able to turn that around for her. But hopefully with the information I provide with you today, you'll have a lot more tools and you'll have a lot more successful outcomes and hopefully a lot more pregnant patients. So let's get started because there's quite a bit to get through, which is quite predictable with me, but nonetheless, here we go. So some disclosures for you, which you can read through later. Now, the oocyte itself, the oocyte, I think, is probably one of the most fascinating components of the human body for many different reasons, least of which, it has the capacity and the capability of being converted into a human life. But the mature human oocyte contains more mitochondria and more mitochondrial DNA than any other cell type in the body. So that's no mean feat, and there's a distinct reason for it, and creation of life is certainly a huge aspect of that. Now, we know that the mitochondria are key factors that mediate reproductive competence, and insufficient mitochondria is basically an aging cell. And a human oocyte that doesn't have enough mitochondria is one that's ineffective or inefficient or incapable of fertilization and eventual embryogenesis. So really important that we understand that all of our treatments need to centralize around supporting that mitochondrial health in significant intensity and impact. Now, when we look specifically at ovarian biology, these are some of those general facts that most of you will be familiar with, but just work with me because we're going to be expanding on that knowledge base as we progress. So we know that at 20 weeks gestation in a pregnancy, a female fetus will have 6 to 7 million oocytes present. And what we don't know exactly is how and why that occurs, why she has so many at such a young age, and why there is this process called ovarian atresia that occurs onwards, which is independent of ovulation. Because actually by the time that female is actually born, it's gone from 6 to 7 million down to 700,000 follicles. And then by the time she reaches puberty, she's all down to 400,000 follicles. So there's this constant atresia process that's very, very rapid in 20 weeks gestation. And scientists are unclear and uncertain as to how and why that occurs, but there's certainly a large body of evidence growing and a large body of researchers looking into that closely. What we do know, though, is that once she reaches puberty, she'll have, on average, 400-odd menstrual cycles in her reproductive life, and she'll lose between 20 and 30 follicles per cycle. Now, the human oocyte is vastly different to other species. And when we're looking at prediction models, we look often at something called a Wallace-Kelsey model, which is this red line here. And the Wallace-Kelsey model shows us a prediction rate of ovarian atresia, which is basically, you know, when she's in utero versus when she's born versus when she's 10 to 15 years of age. They looked at 13 being on average, an average age of puberty onset. Research basically suggests it's somewhere between the ages of 11 or 12 or 13. For puberty onset. And we know that at 25, it's vastly different, but certainly at 35, that's that elusive age of when any of our patients or females, reach the age of 35, they can expect quite a sudden decline in ovarian reserve and fertility potential. And there is the suggestion that the follicles at 35 years of age have declining numbers of mitochondria, so declining levels of reproductive fitness. But we know that, the cell numbers decline quite significantly and quite rapidly. And the theory is that only about 10% of follicles will be released during reproductive life, which is quite interesting. And it's interesting to try to establish and to understand what happens to all of those other cells, considering they have so much mitochondria within them. Now, this is a histological sample of infant ovarian tissue, which I included really just so that you could see just a snapshot of it, it's so beautiful and so rich and so full of all of these follicles, essentially. And so when we're actually having a look at them, we can see all of these beautiful little follicles there. And over time, over those 20 weeks, that follicle number declines quite significantly. And we know that a mature ovary has significant follicle development. Oocytes remain at the diplotene stage of meiosis 1 during development from fetal life and postnatal childhood until they reach puberty, which is where luteinizing hormone starts to surge, when our teens start to want lots of sleep for the release of all that luteinizing hormone, and it stimulates the resumption of meiosis and eventual progression of development of those follicles. When we look specifically at ovarian biology, though, there is that constant oocyte atresia. Now, that constant oocyte atresia has usually a predictable pattern of behavior and a predictable loss, but sometimes that pattern can go awry for a number of different reasons. And women can experience early menopause or POI, POF, depending on the nomenclature that you wish to use. And it can occur in any woman basically at any point. And what happens is that there's a decrease in the initial primordial follicle number, there's an increase in apoptosis or follicle destruction, and or a failure of the follicle to respond to gonadotrophin stimulation. There are many, many different reasons as to why POI or POF occur, or early menopause, depending on how you'd like to word it. But essentially, it's our job as clinicians to try to ascertain and to tick as many boxes as possible to try to establish how and why it is occurring and what may be going on. Is it, a loss of immunological competence, and is there an autoimmune process going on? Is there a genetic propensity towards it? Is it exposure to environmental pollutants? Is it hormone insufficiency? Is it, a whole range of different variables, which we will talk more about today in our lecture. Now, normal follicular genesis occurs at a number of different stages, but we know that we go from primordial to primary to preantral to antral and then to eventually ovulation. And so that all of these different number of stages, we know that as clinicians, we make the most amount of impact to preantral follicles if we do our treatment for anywhere between 3 and 6 months. However, some research is suggesting 12 months of treatment makes the best impact, which I'm sure we've all seen as clinicians in one way or another. But once the follicle has reached that antral follicle stage and eventually ovulation, there's not that much that we actually can do as clinicians. So it's really important that we establish and define treatment for our patients as early as possible. And if we can, make some impact to a woman that's pregnant carrying a female, we can certainly look at influencing the primordial follicle quality as well as number, depending on how we treat our pregnant women. Now, looking at the classification of ovarian follicles, I wanted to just include this here so that when you're looking at sonography reports, you can establish what we're talking about, because they will hopefully give us an antral follicle count, which will be looking at, a size dimension there, which will be looking at how many cells are present, and we can actually classify whether or not they're small or large antral follicles, but we will be given millimetre measurements. And so often when you're dealing with your patients that might be going through IVF or having regular scanning or any assisted technologies, the millimetre gauge will give us an understanding of, are we in the antral follicle categorization or are we in something else? And if it's a pre-ovulatory follicle, we can see that it's starting to get much larger and certainly much larger in number of cells as well. And we class that as a Graafian follicle. Now, human oocytes are vastly different to other species. You can see mouse in blue, hamster in red, pig in yellow, and human in green. And we can see that human follicles, when we're at that pre-antral follicle stage or that incipient antral follicle stage, we can see that our human counterparts are certainly vastly larger in diameter than some of our other species. And then once it reaches that stage, it continues all the way through till it reaches a Graafian follicle as well. So quite illuminating and quite interesting when you're comparing species, especially given that a lot of our research might be looking at mice or hamsters or pigs and trying to extrapolate information about oocyte health. But you can see here there's quite a significant difference when we're looking at human oocytes. Now, I mentioned earlier the concept of the trigenerational impact, and this is something that I really want you to have in the back of your mind when we're considering a number of different variables for our treatment. It's basically the suggestion that there are effects of maternal nutrition on offspring and great-grand offspring reproduction as well. So what we're looking at here is the concept of this might be the patient that's in front of you and the F3 is their future children, but F3 is actually influenced by F0, i.e. the maternal grandmother. So the maternal grandmother might be carrying F1, being the mother, and F1 will be carrying the initial cells of what will be F2, i.e. the child, and F3 will be present within them. So there are what are known as trigenerational studies, and a lot of these were initially looking at obviously animal studies, let's be honest, but then when they started to look at human studies, they did some really interesting research looking at females that were affected by the Dutch famine from the Second World War and how it impacted the maternal grandmothers, their daughters, and then their granddaughters. And what was interesting in that particular research was that the famine and all that starvation and how it influenced, it didn't directly influence the fertility of those women, but it certainly influenced the fertility of their daughters and granddaughters. And what was found was that